I was a foster parent and got interested in legislative advocacy and got involved in several organizations. But what I discovered is that if I was lobbying for foster children, went to the Capitol, I often was competing against organizations that were lobbying for low-income children or children in the juvenile justice system or children in the child care system. So I began to explore whether or not there could be a children's organization. And I encountered several other advocates at a national meeting that I went to and learned that indeed there were a few states that had a statewide child advocacy organization. So I came back to Nebraska and approached several existing organizations, but none of them were interested in changing their mission. One was a statewide organization, but it was a government-attached organization, and I felt this needed to be an independent organization that had no agenda, no obligations, no constraints. And so, ultimately, I decided to start Voices for Children in 1987. While there are many, many similarities, obviously there are also differences. Times have changed from 1987 to 2017. Interestingly enough, the very first data book, if you will, that we published was in 1992. It was called Hide and Seek. And actually, we named it that because it was very, very difficult to find data on children's issues. And so we chose the name reminiscent of the childhood game where someone hides and you count to 100 and then you go searching for that child, typically. The difference between the Hide and Seek data book in 1992 and the most recent Kids Count book is monumental, both in size, but in sophistication and style. So if anybody goes to the Voices for Children website today, they see indeed, not only is there data for every county, but you can go online, you can create data sheets for every county. And so it's really interesting to see that a goal we had in 1992 has indeed been realized, and yet Voices still is striving to improve the data sets and is still advocating for better sources of data because that remains a challenge.
Kids Count report in Nebraska is very important as it establishes data across our state that are reflective of health, education, child welfare, and juvenile justice areas in Nebraska that kids and families need advocacy for. State key decision makers such as state senators, policymakers, healthcare, education advocates to use in developing policies that support a pro-child and family wellness across our state. I use the Kids Count report in Nebraska for developing grant proposals, helping guide decisions in healthcare, in education, in taking a look at developing programs that are going to meet the needs of the kids and families across our state in those areas. My work would be more difficult if the Kids Count in Nebraska report was not published. Without data, we don't have any benchmark of that data-driven resource for kids and families here in Nebraska.
When I think of consistency, I think of continuity, and child welfare system consists of policymakers, elected officials, administrative appointees, and a number of people, including private agencies that are involved. With term limits for legislatures, with elections occurring, with people leaving, it's very important that there be someone that can weave all of the threads together and educate people who are coming into office and are coming into public agency positions about the importance of the specific issues that Voices deals with. Voices has been exceptionally important over the years. There are some of the issues that they addressed that people now would just shrug their shoulders and say, duh. But at the time, it was somewhat revolutionary. For instance, when there was a focus on helping the the Child Protective Service system deal with domestic violence system. They were operating in parallel and sometimes conflicting roles, and so Voices played a big role in that. Voices has had a role in educating the public, elected officials, and other policymakers about the importance of permanency for children, the importance of attachment, the importance of professionalism in adoption and moving children to permanency.
Started out, I didn't know anything about Voices for Children, but quickly became acquainted with Kathy Bixby Moore, and just listening to my other colleagues and other people knew that they were a very well-respected organization, and it didn't take me very long on a personal level to figure that out as well, and knew that these were people who cared about children and would be able to give me good factual information on whatever I was working on. How I was able to successfully pass an EITC bill was totally by accident. I broke one of the cardinal rules of senator is never agree to introduce legislation when it's brought to you towards the end of the 10-day session. My freshman year, my first session, went to a Voices for Children breakfast, visited with Kathy, who talked to me about the earned income tax credit. I thought, well, gee, that sounds really great. She said, well, we're looking for someone to introduce legislation to increase the income tax credit. And I thought, well, that sounds like something I would be on board with, so agreed to do it. When I went back to my office and told my staff, they said, really? You really agreed to that? I said, yeah, not knowing that just the year before there had been an increase passed, and so my staff was like, this is not going to happen. Like, well, we'll introduce the bill and we see what happens. And with a lot of things falling into place, the bill was successful and we were able to be a part of a larger tax package.
It really impacts a lot of the families we serve because basically we're serving the working poor. And in Omaha, Council Bluffs, MSA, about 12% of the population is in poverty. Because that one refund can lift someone above the poverty line. It's the largest poverty reduction program in the United States, actually. And so the Earned Income Tax Credit Coalition is a life changer for a lot of people.
As governor, I found that there were various groups that supported various issues, and Voices for Children was very strong in dealing with children's issues, children's needs and opportunities that the state could be helpful in supporting. And I worked very closely with Kathy, and I worked with others who spent a great deal of time educating me on many of those needs that children have where we could be helpful. When you realize that children are maybe 25% of the population, but 100% of the future, you know how important nutrition is to their development, you know how important education is to their development, and how important health care is for children and their development. And so Voices helped me understand many of the details on how we could be helpful. And in developing the Children's Health Insurance Plan, CHIP, we were able to put together a program that would mean that young people, children, would have access to health care and their growing needs, making sure they have a healthy lifestyle. Any insurance program is helpful, so finding a way to have it available to the children who wouldn't otherwise have health care coverage, this was very important in establishing a program specifically designed for young people.
Ultimately, what Voices for Children is trying to do is make sure that Nebraska responds to youth behavior in an effective way. We want to make sure that not only is the community safe, but also that we respond to that young person in a way that puts them on a path to a successful future. Instead of incarcerating young people, we want to create community-based services so that kids could be served in their communities. It's less costly and also more effective. We also looked at the large number of children who were prosecuted as adults in Nebraska in the adult criminal justice system, and bringing those kids back to the juvenile justice system where they could get services that were better designed to fit their needs. Also, they wouldn't have to deal with a permanent criminal record. So it was really all part of a shift in the juvenile justice system away from costly and ineffective interventions like incarceration, which were producing really bad outcomes for kids and for our state, and moving towards things that had better evidence behind them and were producing positive outcomes for youth. I think some of these changes that we worked on were an important first step in broader juvenile justice reform. I think it shaped the conversation to focus on what the data was telling us about where we were falling short as a state, and to start looking at new and innovative ways of serving kids, keeping communities safe, and making sure that children have an opportunity for a bright future.
So one of the things we've started doing that we're really excited about is working directly with kids who have experienced some of the issues that we advocate on behalf of, to really empower them to be the next generation of youth leaders and youth advocates in our community. I think working to continue to address critical issues of equity based on race and ethnicity for our kids will continue to be really important to us. And we're also looking at some exciting opportunities that would ensure more of our young people have savings accounts that we're really excited about. Feels like we're really at a critical moment for our kids. Much of the progress we've made and much of the success on behalf of kids we see today are based on decades of commitment and work. And I don't know that people realize that when we're talking about things like cutting Medicaid, we're talking about taking health care away from kids. 95% of our kids in Nebraska right now have health insurance. Our child welfare system is in a place that's stable after years of a lot of instability. We've made a lot of progress on reforming our juvenile justice system and keeping more kids out of youth incarceration. But unfortunately, that progress can be undone if we don't continue to make commitments to those investments. And it feels like we're in a moment where we're going to have to defend a lot of the progress that's made and ensure that we're keeping that commitment to ensuring that our next generation has the opportunities that our current kids do. At 30 years old, we've really grown up as an organization. We've built a solid foundation of expertise and history and made progress on a lot of the issues that we're working to address for kids. And we've also started to innovate in the ways that we share data and information about kids, and we're really proud of where we are and looking towards the future.